Good morning, Ma'am Miss. My name is Jamrat Mojado, then I am a student nurse for today. So today, I'll be assessing the Cephalocaudal Assessment. So for the equipment needed, we need a sphygmomanometer, a stethoscope, and here's the thermometer. The thermometer, tank depressor, pen light, the cotton applicator, and the tuning fork, and the clean gloves. So the purpose for this is and the objective of the head to toe assessment checklist is to gain insight into the patient current health status, health needs, and their goals for the health outcomes. So for the preparation phase, prepare necessary equipment. So to avoid some errors and orderly use of the materials, so I already prepare my equipment. So introduce yourself, identify the patient. So to obtain some information to prevent misidentification of the patient. So, hi ma'am, good morning. My name is Jamrat Mojado. Then I am a student nurse for today.
Good morning.
So how's your day, ma'am?
Okay lang po.
Thank you, ma'am. So, prepare the patient and environment. So, to assess the patient easily and warm temperature. So, explain the procedure to the patient. So, providing information, make the patient understand and cooperate. So, hi ma'am, good morning. So, today ma'am, I'll be assessing your head-to-toe assessment, ma'am. So, we call the Cephalocaudal Assessment, ma'am. So, it's okay to you, ma'am? So, thank you, ma'am. So, possessing the patient appropriately. So, to get the assayer sights on assessing the patient. So, I already positioned patient in front appropriately. So, make sure the room is warm, quiet, and adequately lighted to make sure the patient to be comfortable. So, ma'am, are you comfortable with this room, ma'am? So, it's okay the temperature, ma'am? Wala ka ikang arditugnaw na ba, ma'am? So, okay, ma'am. So, ensure the patient privacy to maintain the dignity of the patient throughout the session of the assessment. So, the curtain is down, so I already can secure the privacy. So, perform hand washing. So, we need to perform hand washing to avoid avoid and prevent the spread of bacteria like germs and viruses.
It's cooking.
So before I start, I just want to wear my glove first.
Go.
So, first, we have to take the vital signs taking. So first, the blood pressure. So to get the accurate patient blood pressure. So for this session, I would like to use my sphygmomanometer. So ma'am, can mag-fan kasi mong dugo, ma'am, sa imong blood pressure. Ma'am, okay na ba ni mo, ma'am, nga ibutang ako ni si mong bukton, ma'am?
Yes, sir.
So, okay, ma'am.
Wala, nadagdagan dala. May tig-akit ka.
So your blood ma'am is 120 over 90. So it's normal ma'am. So for the heart rate, so wait the exact side in taking the pulse rate to avoid miscalculation. So ma'am, it's okay to ma'am that I will find ma'am kanang mag-find ko sa imong rate sa imong heart rate ma'am sa imong pulse ma'am. Okay, ma'am. So use the 3 fingers for assessing the pulse. So please breathe calmly, ma'am. So, okay, ma'am. Thank you, ma'am. So, the pulse rate of my patient is 80. So, for the temperature, so determine the body temperature of the patient is not normal, below, or beyond. So, use the cotton of pan roll to sanitize the temperature. I stop. Thermometer. So, okay, ma'am. Dili, ma'am, tikas, ma'am. So, ma'am, pwede nyo ibutay mo kamakiri sa nabughan, ma'am. So, di pa tayo maghulat sa temperature kayo, dugay-dugay pa man siya. So, mag-oxygen saturation tab. If no pulse is present, remove it first to avoid the misreading of oxygen saturation. So, ma'am, mag-find ko sa inyo oxygen saturation, ma'am. So, wala man kahit mga cutics na. So, okay, ma'am. Buka na talay ko. So, for the respiratory rate, so observe the patient breathe properly to get the exact counts of respiratory rate in 1 minute. So, for the temperature result, so 35.9 degrees Celsius, so it's normal. Then, ma'am, please breathe fine, ma'am. Calmly, ma'am, because I will count your respiratory rate, ma'am, in 1 minute. So, ma'am, your respiratory rate is 17, ma'am. Then, in your oxygen, ma'am, is normal, ma'am. 80, ma'am. So, collect the height, weight, and BMI of the patient. So, ma'am, can you please stand up, ma'am? So, I will assess your height, ma'am. So, 5 feet. Then, ma'am, can you step, ma'am? Kay ato na talang timbangan ng ilang kilo. So, your 58. So, 48 kilos, ma'am. Then, to identify the patient is normal, BMI beyond the might as well as below. So, the BMI, ma'am, is normal, ma'am. Your BMI is normal. So, for the performance phase, so first is to the head. So, it's skull. So, inspect for skull, the size, shape, and symmetry. So, ma'am, it's okay tayo, ma'am, that I will touch your skull, ma'am, to palpate, ma'am. I inspect rather. I palpate. Huh? So, So for the palpation, so contour, masses, depression. So to assess, there is no presence, if there is a presence of abnormalities or swelling or redness of the masses. So as I observed during my palpation, so my patient's skull is, there is no presence of abnormalities. The shape is normal as well as the symmetry and masses of depression is seen. So for the hair, so inspect the color, evenness of growth, and other scalp presence or the parasites amount of the hair and palpation. So check also the thickness or thinness texture of the oiliness. So assess for the symmetry of the hair as well as the unwanted parasites in hair strands. So ma'am, I will palpate again your hair ma'am to see any parasites ma'am or mga photo ko yaman mga anak ma'am. So as I observed during palpation, the hair of the patient, so I didn't notice some presence of parasite, but the symmetry of the hair and volume is not equal for the hair loss happen. So for the scalp, so inspect the color, oiliness, presence of scars, leaves and dandruff. So inspect. So I don't see any fine dandruff. So for the palpation, so is palpate for the lesions, masses, and tenderness. So as I observed, no lesions, masses, and tenderness is observed or present. So for the forehead, so inspect for the symmetry of the skin appearance, presence of rashes, scars, pimples. So then for the palpation, so the masses, lumps, and tenderness to assess if there is any presence of abnormalities. So ma'am, can you please ma'am, show your face ma'am, so I will inspect your forehead ma'am. So as I observed, it's nice to say that the patient had no presence of rashes. The symmetry is in the line, but the skin had a little dots or redness because of the pimples is present. Then on the patient face, so for palpation, there is no presence of any masses, lumps, or any tenderness. So for the face, so inspection. So inspect for the shape and symmetry, presence of the scar, pimples, or acne. So palpate for any swelling, masses, lumps. So ma'am, it's okay to you ma'am that I will palpate your face ma'am or I will touch. Yeah. So as I observe for the inspection, so I observe pimples is present and nothing more follows. And for the palpation, everything is normal. The signs of swelling, masses, and lumps. So for the eyes, so inspect the symmetry. So ma'am, can you please hangad kamay ma'am? So as I observe, I inspect the patient eye, the symmetry is normal. So for the eyebrows, so inspect for the hair distribution and alignment and the skin quality and movement, presence of pimples, dandruff, color, and hair. So for the palpation, so presence of lumps, pain, and nodules. So ma'am, it's okay to you ma'am that I will palpate your eyebrows ma'am. Okay ma'am. So, as I observed, so during inspection, so the eyebrows, the distribution of the hair is symmetrical to the other side. Then the alignment is normal as well as the movement of eyebrows and no pimples and dandruff is seen. So for the eyelashes, so inspect for evenness of distribution and direction of curl and color. So ma'am, I will inspect your eyelashes, ma'am. Okay, ma'am, can you please kanang yung close your eyes, then open your eyes. So, okay, ma'am, so for inspection of the eyelashes, the distribution is equal to the other side and direction is upward. So for the sclera, so inspect for the moisture, texture, and the presence of lesions. So as I observe, so the patient's eye is white and the presence of any abnormalities and the finding of the sclera is normal. So for the conjunctiva, so I will use the pen light to see the conjunctiva of the patient. Open your eyes, ma'am. So in conjunctiva, so I inspect for lesions, swelling, color, and moisture patient. So for the presence of pain, so as I observed, for the conjunctiva of the patient's eyes is normal for it because as I inspect, there is no presence of lesions, swelling, and palpation, and no pain is present. So for the cornea, so inspection, so clarify the texture and moisture. So, ma'am, open your eyes, ma'am. So I will inspect your cornea, ma'am. So, the clarity of the cornea is present, and there is no presence of discoloration, smooth, and it is smooth and soft. So for the iris, so during the inspection, so the appearance and the coloration and shape. So as I observe, the iris of the eye of the patient is in the ring appearance and the dark brown color and the round shape of the everything is normal. So for the pupil, so ma'am. Thank you, ma'am. So for the pupils, so I don't see any as what I observe in pupil, the color is black, equal the shape and size, so round is normal and there's nothing to worry about it. So for the nose, so inspection for the nose. So the external inspection for any bleeding, inflammation, swelling, asymmetry, discharge, and color, sense of smell. So for the internal inspection for the nasal, septum, and deviation for perforation, lesion, bleeding, palpation, and tenderness, and presence of pain. So it's, ma'am, so for this session, ma'am, I will palpate or inspect your nose, ma'am. It's okay to you, ma'am? Thank you, ma'am. There's no pain, ma'am. Wala kay sakit, ma'am. So, okay, ma'am, hangad ng face. Pata natin ilalang sa ilong. Hangad, ma'am. Hindi magkatawa, ma'am. Wala, may ako gijoke, ma'am. So, okay, ma'am. Thank you. So, as I observe, there's no bleeding or inflammation, swelling happen. As I inspect, the discharge is watery colorness, the pink moles, the sense of smell is really normal. And as well as I do the palpation, there's no pain and tenderness is present. So, everything normal and in the nose part. For the mouth and lips, so inspection, color, the texture, tracking symmetry, lesions, and hydration. So, for the palpation, presence of pain, lumps, and tenderness. So, ma'am, hi ma'am, nakabalik man. So, magpalpit kapag ko ron si mong kuhan, ma'am, si mong mouth, ma'am, si mong lips. So as what I observe in the patient's lips, there is no signs of crackling, smoke, soap of any lesion is present, and the pinkish for the mouth, there pink yang color sa yang lips, so normal. Then for the mouth, there's no presence of pain as well as lumps and tenderness. So wala kayo nakita nga ini nabdumatay sa yang lips kay usually nagamit yung mga lipstick, ma'am. So it's good, ma'am. Kaya di siya matapin mong lips, ma'am. So for the gums, so inspect for the color, texture, swelling, bleeding, retraction from the tip. So for the palpations, present pain, tenderness, and lumps. So for this session, I will use my tongue depressor to inspect thoroughly the gums of my patient. So ma'am, can you please open your mouth, ma'am? Can you please, ma'am? Ma'am. Apa, ma'am? Sama-sama na, ma'am. Nga pa, ma'am. Ma'am ko niingos gawa sa Mandila. Okay, ma'am. Thank you, ma'am. So, as I assess on the gums of the area, so I didn't any notice signs of swelling, bleeding, or any retraction of the teeth. So, everything is okay and it's positive feedback of the patient gums. So, for the teeth, so inspect the discoloration, number of tooth, texture. So, ma'am, can you open your mouth, ma'am? Kaya ipon natin mo, pila ka ba kung nung ipon, ma'am, or labay, inipan, ma'am? Mga yakmo ba, ma'am, or nga na? Yung open, ma'am. Ay, si katawa, ma'am. Open. Okay. So as I observed, so as I noticed, so the teeth are within color except for the last part, which is the wisdom tooth, has a discoloration, which is black color, signs of refraction. So as I count the overall, it's 32. So for the tongue, so inspection for the color, texture, surface, characteristic, symmetry, presence of lesions, and sense of taste. So for the palpation, palpate for any nodules, lump, presence of pain. So ma'am, can you please open your mouth, ma'am, then say there. Then please out your tongue, ma'am. Ano ka giluod, ma'am? So as I stick out of the tongue of the patient, so the color is pink, raw in the texture, the surface has the whitish coating, the symmetrical, no lesions is seen for the palpation. So patient did not react for the pain. So wala yung sakit imong dila, ma'am? So wala daw. So no nodules as well as lumps. So everything is normal. So and that's good. Good feedback kayo. So for the ears, so inspect for position of the color, size, shape, deformities and inflammation or lesions. Then palpate the presence, pain, tenderness, and lumps. So ma'am, mag-inspect ka si Mandunggan, ma'am. Ako iwak lang yung buhok, ma'am, kaya na ito makita, ma'am. Wala rin sakit, ma'am? Wala rin, ma'am?
Wala ra po.
Okay, ma'am. Thank you, ma'am. So as I observe in the both ears of my patient, so the color is pale, pink, size and shape is symmetrical, no signs of inflammation, lesions. So in palpation, there is presence of pain as well as the tenderness. So the finding is normal and nothing to worry about. So wala kayo problema si Mundong Ganang, so topong na siya ti ma'am. So for the auditory acuity, so the voice whisper test. So to assess the gross hearing of the patient. So to prevent the patient from lip reading through to her peripheral vision. So, for this session, magungong ko sa akong patient. So, ako ay whisper. So, paano mama ka ng istorya siya, ma'am, Laudik mo, sa inyo na dunggan, ma'am.
Elephant. House.
So, as I do the hearing test, so the patient by whispering, she responds directly, so clearly her words, the I utter. So, for the tuning fork test, so a normal Weber test has equally sounds heard by the patient. So, the Weber test, so, ma'am, for this session, ma'am, magamit ang tuning fork, ma'am. So, i-inspect ay kuha na lang na ito na kaling ang tuning fork. So, wala kami tuning fork. So, ma'am. Okay na here, ma'am.
Yes po.
Nandito yun, ha? Okay, so when I conduct the Weber test using the tuning fork, normally the patient is both ears, so the finding is normal po. So for the rain test, so a normal Weber test has the equally sound heard by the patient. Then so kuan ma'am, so karon ma'am sa pikas-pikas na po na siya dong ganito naman kayo, nagaling mo siya ma'am. So wag ma'am. So, ma'am. Dog running out by side, ma'am.
Yes po.
So, as I observed, the rain test for the patient both her properly and the finding is normal. So, for the neck, so inspect the symmetry of the sternocleidomastoid muscles, then the anteriorly and the trapezoids posteriorly, then do the palpation, so palpate the presence of masses and tenderness. So ma'am, inspect lang si ma'am neck, ma'am. Yeah. So during assessment of the neck of symmetry of the sternocleidomastoid muscles of the trapezoids are both equal and no masses of tenderness is seen. So for the lungs and thorax, for the chest anterior, so inspect for the breathing patterns, red, deep, and causal angle shape of the patient chest and color. So, ma'am, dirita mag-spec si chest, ma'am. Tao na to kung pupong. So, pupong naman siya. So as I observe, the patient has the pink undertone. So, makita na tong color. Then, which indicates the normal oxygenation. The clavicle is symmetrical and the sternum located exactly in the middle. And the chest movement is symmetrical. The patient has 17 breaths per minute. So, ganina, nagkuhan ko 17 breaths per minute kayang kuhan. Then, also respiration is smooth and even, which is indicate a normal finding. So, for the palpation of respiratory excursion and tenderness, masses, and temperature. So, okay, ma'am. So as what I observed during the palpation, both anterior and posterior respiratory, there is no signs of for masses, tenderness, and the temperature is warm. So the precaution for is different sound. So for the chest, so ma'am, kanina pa na ako ma'am yung chest, ma'am ha, yung precaution. Okay. So as I said during the percussion, the sound is there on different sides. So auscultate for 2 breaths and sound. So for this session, I will use my stethoscope. So as I observed during the auscultation, the full 2 breaths and sound are there and it's normal. So for the lungs, so auscultate the breath sounds of trachea, plexus, bronchi. Then, sige ma'am, mag-auscultate ang balik ma'am. So, so as I ausculted for breath sounds, so the trachea, plexus, and bronchi, the sound is different in the difference. But for the chest posterior, inspect for the shape, symmetry, signal alignment for deformities, color abnormality, then inspiratory. So as I do the observation kanina, so during the inspection, the patient chest has no signs of deformities. Then shape and symmetry in equilibrium. The color light pink and northern is found. So for the palpation, so temperature, respiratory excursion, and vocal firmitus for the precautions. So precautions for sound. So ma'am, kayo fine ma'am. Sa inyong likod ma'am. Ma'am, can you please breathe fine ma'am normally? Precause the posterior chest of the temperatures or the respiratory excursion and vocal firmitus, no signs of pain as well as the tenderness and edema also are the lesion. So for the auscultation, or kasi normal and abnormal sounds, so magpalpate pag normal o abnormal sounds yan ka. Ma'am, can you please ma'am, kanang ato bang ma'am? Clear ito sa good. Ma'am, can you breathe quiet, ma'am, normally? So, as what I observed during the auscultation, the posterior chest of the breath sound present are both. Then, the bronchial and vesicular sound, which indicates for normal sounds breathing. So, for the abdomen, so inspect with the colors, scars, rashes, and lesions, the umbilicus, contour, abdomen, hair distribution, symmetry, respiratory, and movement. So, ma'am, kuan ma'am, inspect natin yung kuan ma'am, abdomen ma'am, can you please gato bang ma'am? So, inspected na lang kay babae man siya. Pwede ka makita ma'am. So, inspect na nato ma'am. So, as if during the inspection, so the abdomen of my patient is good and I don't see any problems of the color, scars, and then the rashes, the lesions, the umbilicus or the contour of the abdomen, hair distribution, and symmetry, respiratory movement. So, normal yung abdomen, so I don't see any abnormalities. For the auscultation, so the fourth quadrant for the basic sound, vowel sound. So, ma'am, magkwanta, ma'am, mag-percuss na mo sa mga abdomen, ma'am, sa 4 vowel sounds, ma'am. So, it's okay to yung ma'am. Percuss. So, ay, ano gamit ko stop, sorry. So, mag-percuss na sa sounds. So during pan, so mag-kuan po tama, maggamit. Inhawa, ma'am. So during percos and inculcation, so the 4 quadrants, so I didn't see any deformities from it and it's all normal. So for the palpation, so the 4 quadrants for pain and the bowel and distribution. Tingog daw, ma'am. A, ano daw?
A, B, C, D, E, F.
So during palpation, so the 4 quadrants, so I didn't see any pain. So kuan wala siya sakit na kuan, so nagsinisira man siya. So my patient response and the bladder and bowel distension are all in good condition. For the upper extremities, so upper and lower extremities, so inspect for the size, color, contour, symmetry, and involuntary movement. So look for deformities, edema, and presence of lesions. Always compare the both extremities. So ma'am, so diri ka sa babaw ni mo magkuan pa sa mga upper extremities, ma'am, which is diri sa babaw, ma'am. So upper ni siya. Sige, ma'am, ganang perform the abduction, ma'am. Abduction. Umubo, ma'am. So flexion na punta, ma'am, kana ma'am, then above the head, flexion. So okay, ma'am. Thank you, ma'am. So as I observed during the inspection of the upper and lower extremities of my patient, so they're all good extremities of my patient, they're all good condition, and I don't see any problem at all. So for the palpation, feel the heaviness, temperature, range of motion, test of muscle strength, check the capillary refill of wrinkleness and toenails. So ma'am, kanang mag-assess the assessment ni mo, ma'am. So ma'am, gidaw, ma'am. Anak, ma'am, can you please? Anak, ma'am. Sa i-push ko, ma'am. I-pull. So okay, ma'am. Then anak, ma'am, can you please? Anak, ipalin mo kamot, ma'am, si abduction. Flexion, ma'am, flexion. Then kana pangusob, ma'am, pasulod. Pagawas. So okay. Then ma'am. I-push, ma'am. Pull. And direct the push. Painful. Huwag kayo please kan ma'am, ibaba yung tail mo. Ma'am, can you find ma'am please round your toes ma'am? Okay. Lihat yung fingernails ma'am ng tail. So, kanina pagtikas ma'am, i-round. Lihat yung fingernails. So, okay, during the palpation observation, the range of motion and muscle strength and the refill of fingers and toenails are in good condition. And the response of strength is there, and I don't see any problem at all. So, for the others, make findings of the health assessment and physical examination, so done on the patient. So, ma'am, as during assessment, ma'am, so wala ko yung nakita, so I don't see any abnormalities, ma'am, sa imong from head to toe assessment, ma'am. So, you're all normal, ma'am. So, naka-strength. So, wala ka any presence of lesions and kwan, ma'am. Mga hubag-hubag, ma'am, or imong kwan, ma'am, imong muscle strength na, ma'am. So, it's all normal, ma'am. Then, for the kwan, so, I remove first my kwan, my gloves and wash hands. So we need to wash our hands to clean properly after the assessment. So in order to prevent the spread of infection. So the examination, record and report any pertinent finding found during the assessment of the appropriate personnel. So So overall, no, I don't see overall no abnormalities is present, and the information that I documented will be read by the physician, and following assessment will be conducted for the physician for verification. So ma'am, ang final na to aning kwan ma'am, na ma'am, isa na to sa mga attending physician ma'am. So thank you for your cooperation ma'am, and that's all. Thank you.